Happy Monday, guys. We're 8 days from the Flab to Fab challenge. And today I am going to be demonstrating how to give yourself your injection if you're using injections. Just for clarity, to be a part of this challenge, you do not have to be on weight loss medications. And you can come just for the accountability. We're going to have a weekly group chat. You're going to get challenges via WhatsApp. You're going to get a nutrition plan, and you'll get me as your personal accountability coach. But today, let's learn how to give our injection. Okay, guys, step one, and this is the most important step, so don't skip this step. Wash your hands. Like, have you ever been in the restroom and you see people just walk out and you're like, whoa, what are you doing? So yeah, the last thing you want to do is transfer bacteria from your hands to your skin, and then break your skin with the needle, because then you may get an infection. One of the best ways to know, have you washed your hands enough? Sing happy birthday while you're washing your hands. I have long nails, so I always make sure I'm getting up under my nails as well when I wash my hands. And that is step one. Do not skip this step, and do not just simply use hand sanitizer. Even though it is good, I still want you to actually wash your hands. Hate to have to say it, but I do. Step two, remove your vial from the box. Important step. If you are using multi-use vials, then you need to clean the top of your vial with an alcohol swab. And even if you aren't in your OCD, you might want to anyway. But if it is a brand new vial and you've just opened it, it should be sterile. Then you're going to take your needle. Be sure, I've had so many people give themselves too much medication because they don't know the difference between units and milligrams. So make sure you actually read the needle and see whether you're supposed to give yourself 20 units or a milligram dose, okay? When you open the needle, there'll be air in the top. You do not want an air embolism. Push that air out before you start to withdraw your medication. Then you're going to insert the needle. It's small, but you should be able to see the tip in there. And then slowly, even though you're not going into an artery, you still want to leave that pocket there. And that's also the reason. So now I'm seeing just medication coming out. Okay, ab check, guys. It's summer. Summer's almost over. Not as flat as I want to be. My goal is to lose 13 pounds with this challenge. And so I'm going to pinch myself here. I like to do the side where I have a little bit of extra mommy handle. And then after pinching your skin, take the needle, inject. Should not hurt. Pull out slightly, and then push. Once all the med's in, pull out, and I usually just put my thumb on that area, even though I pretty much never bleed. But some people are more prone to bleeding, and if you... All right, guys, last step, we're going to dispose of our needles safely. You see I'm putting the cap back on. Never throw needles in the garbage without the cover. You don't want a garbage person to get hurt. Then I am going to grab a water bottle, empty it out, and put it in here. So this becomes my sharps container. That means it's capped and it's in there. And then you can, if you don't have a biohazard service, you can bring it to the pharmacy. You can bring this bottle of needles to your doctor, ask them to dispose of it, just to make sure it's disposed of safely. So if you have any questions, put them in the comments. My next video will be on semaglutide versus tirzepatide. What is the better drug? So if you're struggling with weight, I highly encourage you, join the challenge starting September 1st. Now, time to see patients. But if you found this video helpful for yourself or a loved one that is trying to lose weight, definitely share so those that need the help can get the help and support that they need. Dr. Tisha Rowe, family medicine physician in Houston and Miami, actually all of Texas and all of Florida. And check out my site, myglpmd.com.